How do you treat turkey neck? So the neck is one of the most revealing areas of the body when it comes to aging. The good news is that with advances in aesthetic treatments, which vary from simple topical treatments to more high-tech solutions, we don't simply have to accept turkey neck anymore. I'm Dr. Owen Thomas, I'm an aesthetic doctor in London, UK, and I'm going to tell you how you can reclaim confidence whether you're looking for a simple improvement or a more dramatic transformation. So what is turkey neck? It refers to the skin of the neck which starts to sag or even drop down. So the particular factors that make neck skin more prone is that the skin is thinner, it's got less sebaceous glands, and therefore it's more prone to damage. It's often overlooked with sun protection, and UV radiation will help to break down the collagen that's there. There's often a lot of movement in the neck, we're often looking up and down, and there's something called tech neck where people are looking down at their phones, creasing the neck. Also the platysma muscle, which is a muscle which comes all the way from the collarbones into the face, is very thin, and if we're not fit and we don't look after ourselves, then this can start to break down and separate. That's another cause of aging in the neck. So I'm going to break down the topical treatments that you can use at home briefly. First of all, we've got retinols. These are retinoids which are on prescription, or retinols that you can buy over the counter. These are substances derived from vitamin A, and they increase cell turnover, they make the skin stronger, they build collagen. They also help with pigmentation, perhaps not as much as some of the other ones, but they're a gold standard in terms of topical treatments. They've got a huge evidence base behind them. One of the problems with retinols is that it starts to cause skin irritation, so you have to start at a very low dose and build it up, like retinol 0.25%, then 0.5%, and so on. You can also use other topical treatments alongside the retinols which might combat that irritating effect. Studies looking at retinols show that there's a significant improvement in skin thickness and elasticity, although the effects are usually seen from about week 12 onwards. Then we have peptides. These are small chains of amino acids that are cell communicators. They signal within the body, and they also increase collagen and elastin. You can think of them as a milder version of retinol, but they're very useful and well tolerated, and they can be used in any part of the body in terms of skin, even on the delicate neck area. Examples might be argireline or copper peptides. So when we're using vitamin C and vitamin E, it starts to give the skin a brighter glow and even pigmentation. It's very good for pigmentation. Fine wrinkles might improve a little bit, but less so than retinols. The antioxidants stabilize the skin, and we know that they also make SPF work more effectively. One slight downside is that they can cause tingling or mild irritation, although less so than retinols, and it has to be kept in a dark container because light will degrade, particularly vitamin C. So hyaluronic acid is the king of hydration. We know that it holds on to about 1,000 times its own weight in water, so it's immensely hydrating. Especially injectables are markedly hydrating, but even topical treatments hydrate the skin. It's really good for giving an immediate quick lift, so it makes the skin plumper and fine wrinkles reduce. One drawback is that it has to be applied consistently because the effect doesn't last that long with topical treatments. And then we have perhaps lesser known other treatments like growth factors. These are relatively new substances. They're a bit more pricey, but they can be used on any area of skin. They're really well tolerated. Examples might be transforming growth factor beta or epidermal growth factor, and these are gentle additions leading to a gradual increase in collagen, maybe for people who can't tolerate some of the other treatments. So there's lots to choose from with topical treatments. I might suggest maybe a combination treatment would be good. You could use a retinol, which is so evidence-based, one of the gold standard topical treatments, and maybe use that with a hyaluronic acid, which gives rise to hydration and could soothe some of the irritation you're getting from the retinol. Maybe you could use that combination at night, and in the morning you could use a vitamin C serum and then put SPF on, and we know that the vitamin C is going to make the SPF work even more effectively. So there are some combination creams that you could consider buying. They're a little bit more pricey, but very effective nonetheless. You've got elastin restorative neck complex, which has got peptides and antioxidants, which is good for tightening and firming the skin on the neck, or SkinCeuticals tripeptide neck repair, and that's retinol with tripeptides. Now we're on to home treatments for turkey neck. First of these is neck exercises, and this is something that many of my subscribers really love and find effective. So neck exercises are predominantly strengthening the platysma muscle. This is simple exercises. This is rotating or flexing and extending the neck, strengthening the platysma, and if we can strengthen the muscle, we know that it's going to stay stronger and give an underlying support to the skin. So the benefits are that it's easy to do. You can do this at home. Drawbacks are that you have to really put the effort in to comply with this. It's not going to happen overnight, and if you stop doing it for a long period of time, the benefits are going to wane, and it's not going to improve the actual skin itself, but it will provide an underlying support. A study in the Journal of Geriatric Physical Therapy found that facial and neck exercises did improve muscle tone and led to a slight reduction in the appearance of neck sagging, but the results were rather subtle compared with professional treatments. And I might suggest that general exercise like running, swimming, HIIT workouts, whatever it might be, will also be good because we're using our neck constantly to maintain our center of gravity. So I think that probably would be as good as neck exercises, in my opinion. opinion. Other home treatments include SPF protection, and that is so vitally important for skin health. UV radiation is one of the main factors in aging. We also got a healthy diet. If you can eat lots of fruit and vegetables, that's naturally going to be high in antioxidants, and that's going to complement some of the topical treatments that we talked about earlier by reducing those free radicals which damage the skin. Another home treatment is red light treatment, and this is using near infrared treatment. It's also known as low-level laser treatment, and this is known to stimulate some of the fibroblasts in the cells. So we're doing the same thing as we're doing with some of the professional treatments. The red light seems to stimulate these cells by increasing energy in the mitochondria. That's the powerhouse of the cell, and that's what drives the production in collagen. There's quite a few studies over the last 15 years or so looking at red light, and it does show that there's a consistent improvement in collagen density, skin thickness, skin health, and fine wrinkles. I've got a forthcoming video on red light treatment, so if you're interested and you haven't done so yet, then why not hit the subscribe button and you'll be notified about that when it comes along. Now we're on to non-surgical treatments, and there's a few of these to try, and it really depends on the extent of the neck laxity to begin with. So for younger people or people with minimal skin laxity who just want to maintain skin health in the neck, then you probably just want to use a skin booster or a hyaluronic acid. This could be something like Profilo if you want to keep the skin hydrated, but there's relatively small amounts of collagen from Profilo, so I would probably suggest something like Jalipro, which has got amino acids which increases the amount of collagen quite significantly over a few sessions. Another type of treatment might be polynucleotides, and I've got a video about that treatment that you can look at here. I'm a big fan of combination treatments, so I often use polynucleotides and mix with Jalipro, so we're increasing the amount of the fibroblast cells underneath the skin, and we're actually stimulating them to make more collagen and elastin. So for people with more moderate skin laxity who are developing turkey neck, then you could use a device treatment. This could be radiofrequency microneedling or HIFU. For the RF microneedling, I use Morpheus 8. So for Morpheus 8, we have microneedles which go into the skin 1 to 4 millimeters, and this supplies radiofrequency energy which heats the tissue. That can cause a contraction effect. It also can improve the skin surface. So HIFU is high intensity focused ultrasound. This is focusing a beam of ultrasound just underneath the skin so it can reach quite deep. And similarly, this causes a heating energy effect, and this can cause contraction of the collagen and tightening of the skin. And there's not a lot of comparative evidence to say which treatment is best. HIFU does seem from some studies to be slightly better for moderate to severe laxity, whereas Morpheus 8 and RF microneedling are probably best for moderate neck. While there's no comparative studies between Morpheus 8 and HIFU, there does seem to be a little bit more tipping the balance in favor of HIFU with moderate to severe, but it's thought that RF microneedling and Morpheus 8 are still very good for mild to moderate neck laxity. A study in a laser journal in 2019 showed that the group of patients who had HIFU were more satisfied with the lifting effects, which was better for skin laxity, although there was more skin improvements on the surface with RF microneedling, which is exactly what you'd expect. Therefore, if you've got no skin surface problems and you're wondering about skin tightening with a device, it might be slightly better to go for HIFU, but we know that RF microneedling also has some effects. Now we get onto my favorite non-surgical treatment for turkey neck, and this is called Hyper-Dilute Radiesse. So you might have seen from other videos, if you've watched them, that Radiesse is a calcium-based filler, which gives a really high lifting effect when it's used as a dermal filler. But when it's diluted, it becomes a biostimulator. The little calcium microspheres settle underneath the skin, pressing on degraded collagen fibers, and this stimulates the fibroblasts to produce more collagen. As well as the collagen effect, it also stimulates growth of blood vessels to the skin, giving it a more healthy appearance. So the skin gets thicker, it looks healthier. It also seems to adhere the skin to the superficial fat, which is really crucial when you're trying to treat skin laxity in the neck. To treat with the Radiesse, we use a cannula, which is a small little tube which goes just underneath the skin. It won't actually get through the skin because it's not sharp on the end, so we make a couple of little holes with local anesthetic, and I go fanning from one side to the other, gently placing the cannula underneath the skin and dispersing the product evenly. So as with all of the collagen treatments, that includes the Jalipro, Morpheus 8, the HIFU, and Radiesse, this will all need a number of sessions because all collagen treatments need a few sessions over a period of months, and the results are gradual as the collagen takes off. So for the Hyper-Diluted Radiesse, 2 sessions would be needed for most people, sometimes 3, and they'd be spaced about 6 weeks apart. So I love Radiesse because it's the gift that keeps on giving. The calcium microspheres stay there and they act as a scaffold for the collagen to grow around it. Even after 12 months, there might be still some stimulatory effect, which is probably more, I think, than the device treatments. One last thing about the Radiesse I like is that it gives a very slight volumizing effect. It is a filler, even though we've diluted it, and it spreads around, gives a very subtle volumizing effect, which is great while we're waiting for the collagen to take over. We get onto surgery, which is the best treatment for repositioning of tissues, and this gives a long-lasting dramatic improvement, which can be really great when people are beyond the realms of non-surgical treatments. So for surgical intervention in the neck, we're looking at a cervicalplasty or a platysmoplasty. This is where the skin and tissues are repositioned, excess skin might be removed, and this can give a very dramatic, rejuvenating appearance. Of course, with surgery, it's more expensive. There's a longer downtime, particularly with these types of procedures. It can last a couple of weeks with bruising and swelling, but ultimately the results can be amazing. So there's lots of different combinations of non-surgical and topical treatments. Personally, I tend to like a combination of generally keeping fit and active, doing lots of exercise. If people have got moderate neck laxity, I would use Hyper-Dilute Radiesse into the neck. I would maintain that after the initial course with Jalupro and polynucleotides, and I'd advise the person maybe to use retinols and peptides as a combination treatment at home. Everyone is different, and it's good to go and see your aesthetic practitioner for a bespoke consultation to see which is the right treatment combination for you. One condition that commonly coexists with turkey neck is jowl formation, and I've got a video on this which shows why that occurs and how to treat them. So if you want to check that one out by hanging around, I'll see you in the next video.